Good evening. I see we have people trickling in, so thanks to all of you who have joined us tonight. I'm Melissa McGarry from TPOD Trumbull's Prevention Partnership. I'm going to be handling kind of the housekeeping and doing some moderating for tonight. Throughout tonight's presentation, if you have questions, you can pop them into the Q&A. And then as we go, we will also share some information through the chat, so you should be able to access that. But first, I want to welcome our first selectman, Vicki Tesoro, who's going to welcome all of you and present our speaker for the evening. Thank you.
Thank you, Melissa, and welcome to everyone. Thank you for attending this first event. And I just want to welcome everyone to our kickoff for our new series, Let's Talk Mental Health Trumbull. Through this series, we hope to highlight and demystify mental health topics. Many of our families are faced with mental health struggles, and we want to offer authentic dialogue to open the conversation so we can support each other. Our mission is to offer practical suggestions as well as resources both inside and outside our town. I've always believed that we are at our best when we work together. Let's Talk Mental Health Trumbull is the product of a collaboration between various organizations in our town that care about the mental health of our youth and families. I want to thank these partners: Trumbull EMS, Trumbull PTA Council, the Mary J. Sherlock Counseling Center, TPOD, Trumbull's Prevention Partnership, my friend Abby, and Confident Health. It is my pleasure to announce that our next session in the Let's Talk Mental Health Trumbull Speaker Series is scheduled for March 16th at 7 p.m. Dr. Alicia Farrow will speak about the pressure to be perfect and its unattended consequences. We hope you can join us on March 16th. Now it is my pleasure to introduce our kickoff speaker, Valerie Barton of the Youth Mental Health Project. The Youth Mental Health Project is a national organization that helps families and communities to better care for the mental health of youth. YMHP focuses on parents and caregivers because young people look to the adults in their lives for guidance. So it's critical that they are given the tools they need when a child is experiencing a mental health challenge. Youth Mental Health Project is headquartered in Darien. Valerie Barton joined the Youth Mental Health Project in 2021 after many years working in leadership roles in the healthcare sector. Her experience spans government service, consulting, and digital health. Throughout her career, Valerie has advised health systems, life sciences companies, and advocacy organizations on data-driven strategies for improving care delivery and the patient experience. In addition to her work at the YMHP, she has served on many not-for-profit boards that work to improve care for underserved populations and those coping with mental health challenges and substance use disorders. Valerie was drawn to the Youth Mental Health Project because of her own experiences of isolation, pain, and fear as the mother of a child who struggles with his mental health. She's energized by the vision of YMHP and is driven by making it easier for parents and caregivers to meet the needs of their children through high-quality support and resources. Valerie currently serves on the board of Micah House, a Washington, D.C.-based nonprofit organization that runs a group home for women transitioning out of substance use treatment into independent lives, and on the advisory board for Sepsis Alliance. In her free time, which she doesn't seem to have many or much, she enjoys yoga, reading, traveling, and spending time with her husband, teenage son, and rambunctious Boston Terrier named Toby at their Maryland home. Welcome, Valerie.
Thank you so much for that lovely introduction, Vicki. Good evening, everyone. I am so pleased to be here. Next slide, please. So I wanted to start off by telling you a little bit about, excuse me, my own experience with youth mental health. We adopted our son from Russia when he was 2.5. That was in 2006. And he had spent the first 2.5 years of his life in an orphanage. By the time he was 4, my husband and I noticed some strange, kind of troubling, puzzling behaviors. And he really began to struggle, and it was very frightening. My husband and I could see that he was different, particularly when he was with other children. And we would regularly get calls from his preschool teachers talking about how his behavior, though not violent, was upsetting to other children. So the photo on the slide, excuse me, was taken when our son was 4 and at the beginning of the most difficult 6 years of our lives. It took years to get his multiple diagnoses. And then we also juggled weekly therapy appointments, psychiatrist appointments, because in his case, he needed medications. And it took a long time for us to get the right mix of medications to support him. By the time he was in 4th grade, he had been in 3 different preschools and 3 different elementary schools until we found one that had social, emotional learning and behavioral supports that could help him be successful. During this time, I had chronic headaches, I had insomnia, I couldn't sleep, and was in kind of constant physical pain with very strange ailments. And my husband wasn't doing much better, really. We felt judged as parents because we were being judged by parents, other parents in schools, and even some family members. We were doing everything that we possibly could do to help our child, and he was still suffering. And it was incredibly isolating and very, very difficult. And at that time, there really weren't supports for parents and caregivers. And there really wasn't good information. There was a lot of academic information that you could find, but nothing that could help us with making the difficult decisions we needed to make on behalf of our son. I tell you this story, and I start off with this evening, not because our story is unique, but because it is so very common. Across our country, there are millions of parents who are struggling with kids who are as complicated as our son and with even more devastating stories. So I joined the Youth Mental Health Project so that I can be part of helping parents and caregivers and families not to feel isolated or alone or as overwhelmed as we did. Next slide, please. So my goal this evening is to help raise awareness about youth mental health and to leave you hopefully with 1 or 2 things that you didn't know before, and also to make you feel okay about advocating for what your child needs. You know your child better than anyone else, and you know what they need. And if your child is struggling with mental health, you are going to have to advocate for them. And so in order to do that, you have to give yourself permission to ask for what your child needs and also for what you need as a parent in order to parent your child who is complicated. And as they say on airplanes, put your oxygen mask on before assisting others. Next slide, please. So a few quick words about who we are and what we do. Our mission is to educate, empower, and support families and communities so that they can better understand and care for the mental health of our youth. So to that end, we offer different programming. So we have something called the Parent Support Network. These are meetings that happen either virtually or in person, and they are run by parents and caregivers who have raised a child who struggles with their mental health. So when parents come into that room and they are very raw and they need support and they're explaining what is going on in their lives, the leader, the facilitator of the meeting can say, I understand, because they actually do understand. And in the meetings, parents also help one another. So did you try this? Did you try that? I tried this. They help troubleshoot. And it's a place without judgment. So they can be as honest and raw as they want to be or can be. And they know that they're among other people. And so they find that kind of community. We do film screenings. You see on the slide, No Letting Go. That is a film that was made about the experience of our founder, Randy Silverman, as she struggled raising her child who has bipolar disorder. We also have something called the Mental Health Monologues, which are performance pieces. We had young people write about their experiences of youth mental health, and we had young actors perform them. And it's the first one in a series. And we intended it to be a conversation tool between parents and kids, because they sometimes can't really put their finger on what's happening or what they're going through, or they can, but they're just reluctant to express it. So this opens up the lines of communication. We also do public events like this one. We talk to schools, PTAs, other organizations, anyone who is interested in supporting the mental health of youth in the community. And we also have a lot of free downloadable education materials on our website. So what actually is mental health? Next slide, please. We all kind of notionally know that we have mental health and it exists, but what is the actual definition? There are a number of them out there. We like the one at the World Health Organization because it has the components of emotional, psychological, and social well-being. This is important because these things drive behaviors. So if you as a parent can think of yourself as at one point, maybe you have, you're like really patient with your kids, but one day you've had a bad day at work, or you're stressed, or you're tired, or you've had an argument with your spouse, and you snap at your kids. That behavior comes from somewhere. It comes from your psychological and emotional state. So when we're talking about our kids, if they're behaving a certain way, there's a reason for that. There's something behind that behavior that we're seeing. You also see on this slide the 6 dimensions of mental health. So does your child have the mix of physical activity, intellectual engagement, and social interaction that's right for them? So for some kids, they might feel best when they're out all the time. They're in a lot of activities, they're socializing. That's the right level for them. Other kids might be good with 1 or 2 close friends, spending a lot of time online gaming, and that's where they're happy. Do your kids feel able to manage their emotions in age-appropriate ways? And finally, do they feel spiritually well and exist in a home and school environment that enable them to feel safe and secure? Next slide, please. At the Youth Mental Health Project, we don't like saying that someone is schizophrenic, right? Or someone is bipolar. We think, because we believe that mental health lies on a continuum, like physical health. So this is one of our core principles. So think about physical health. Some days you may bounce out of bed, you're well rested, you go to the gym, you just feel really good. Other times you might have a cold. You might end up in the hospital with a broken bone or a very serious condition that puts you in the hospital for multiple weeks. So physical health isn't static. It's also the case with mental health. There are different factors that may challenge your mental wellness. Things like the death of a parent. For young people, it could be breaking up, having a boyfriend or girlfriend break up with them, or a fight with a friend, or something they see on social media. So all of these can challenge your mental wellness. The good news is there are things that we can do to support our mental wellness. So one of the things that I've noticed over the past couple of years of the pandemic is that people are posting a lot on social media. I'm baking bread, #wellness, right? Or they're doing yoga, or they're taking a hike. And I like that. It kind of gives me the warm fuzzies for a couple of reasons. One is that they're being really open and saying, this is what I need to maintain my mental wellness. This is what I'm doing. Or they're implicitly saying, you know what, I don't always feel mentally well. And so I'm giving myself permission to do these things that I need to feel better and refill the tank. So the main point here is that mental health varies throughout life, just like physical health. Next slide, please. So I think before we get into sort of why our kids are struggling, I think it's helpful to be reminded of the fact that the youth mental health crisis is not solely an American phenomenon. The chart that you see is part of a UNICEF study on the global burden of disease. They compiled data from 204 countries and territories between 1990 and 2019. And globally, almost 43% of kids report anxiety or depression, and other mental health conditions are also exceedingly common. So the global burden of our youth mental health crisis is significant. It also says to me that even though we have a very American focus on the things that cause stress in our lives currently in the environment that we live in, there is stress, depression, anxiety wherever people live. Those stressors might be different in different countries across the world, but anxiety and depression are part of the human condition, and it is common to who we are and everywhere around the world. I think that in some ways our society has become more open about mental health than a lot of other places in the world. So let's start talking about why kids are struggling so much. Next slide, please. So here's the scope of the crisis. These are just some statistics. Suicide is the second leading cause of death for young people between the ages of 10 and 24. It's second to accidents. 1 in 5, that's almost 18 million children in the US has a diagnosable mental health condition. Why do we say diagnosable? Well, we know that some kids are struggling, but they don't know why, or their families don't know why. There are barriers to accessing care for many communities, particularly disadvantaged communities and communities of color. So there are a lot of reasons why somebody won't have a diagnosis. But if you're talking about the true picture, the true burden of the youth mental health crisis, we must count those kids as well. We also know that 50% of lifetime cases of mental health conditions present before the age of 14, and 75% present before the age of 24. So what this means is that people in their late 20s, 30s, 40s, 50s, and beyond, if they are struggling with their mental health, that has been present for a very long time. Also, what this means is that we have a window of opportunity when kids are young to really help them understand and articulate their feelings and emotions and begin to model behavior for them in positive ways that can change the trajectory for future generations. We also know that because these access issues, fewer than 20% of youth who struggle with their mental health receive treatment. Now, these 4 statistics are from before the pandemic. So this youth mental health crisis has existed for a very long time. What we know is that the pandemic has kind of brought this up forward in people's minds and forced it into the open. And that is the last bullet on this slide. ED visits for suspected suicide attempts among teenage girls were 51% higher than before the pandemic, and 4% higher for adolescent boys. Next slide, please. So I have the opportunity in my role to speak with both adults and teens. So I get the opportunity to hear their different perspectives. So in preparing for tonight, I looked at a bunch of research to see, excuse me, if what I've heard anecdotally bears out in the aggregate. So there are 2 charts here. The one, and I have to say, is like a data geek, that these are 2 different charts of 2 different studies, 2 different points in time, and 2 different study populations. But it sort of, they both, and all of the other ones I found, point in the same direction. So the first one on the left was a survey of kids done by the Pew Foundation, and it was between the ages of 13 and 18. And they asked which one of these issues was present in their community among their peers. 70% had said anxiety and depression. So this is consistent, right, in some way, with that, the presence of that globally. And also, this is across all communities. So rural communities, suburban, so regardless of socioeconomic status or the community that you live in, or your demographics. On the right-hand side, we have a survey of parents, and this was done during the pandemic, about what changes they've seen among the mental health of their own children. So you can see 36% of parents of teen girls indicated that their daughters either had a new mental health condition or crisis, or the pandemic exacerbated that. And that tracks back to the slide on the stat on the previous slide about the increase in suspected suicide attempts and ED visits among adolescent girls. Next slide. So here are some factors. When I talk with kids, there you can see on that list, there are a whole bunch of reasons why kids could struggle. There are certainly genetic components to mental health conditions. Maybe a kid has had a concussion. Maybe they're depressed because they can't do their normal activity, or it's taking a long time for them to recover. But I want to talk about 2 main issues, social media and academics. There's been a lot of studies, a lot of press that have been done about the deleterious effects of social media on youth mental health and adolescent development. And there have also been, so when I talk to kids, they're really aware of this. And so they often will ask, well, should we get off of social media? And what I tell them is, that's really not realistic, because we're all on social media to one degree or another for the most part. And it is an important part of the social life of kids, of adolescents in particular. So it's a good idea to take breaks from social media just to sort of recalibrate. But I think it's also useful. And what I tell them is, don't compare your insides to other people's outsides. And you're living inside your own brain. You know that of your own insecurities, your own feelings of inadequacy, what kind of talk track you have in your own brain. And what you're seeing is everybody putting the best foot forward on social media. And you don't know what else they're dealing with when they're not doing that post. So it's unfair to yourself to compare apples and oranges in this way. And so going into your interactions with people on social media, just sort of keep that in mind. We also know that there is actually action on Capitol Hill at the federal level about youth mental health. There have been lots of hearings, and there are lots of bills and legislation floating around. Just today, I saw that there was a bill introduced, Kids Online Safety Act. This is a bipartisan bill that was voted out of committee unanimously. And the committee was led by Senator Blumenthal, who is a Democrat, and Senator Blackburn, who is a Republican. And what this bill would do is two things. One is begin to hold social media companies accountable for the algorithms that they have that target young people in harmful ways. It would also give parents more options and sort of put a mandate, an expectation on social media companies to create parental controls so that parents can have better tools at different ages to help their kids and equip them with support and limitations on social media. The other thing that I hear a lot about is academic stress, and I hear about this across the board. There have been a lot of studies also that academic stress is hitting at younger and younger ages. And when I talk to teenagers, they'll say, well, it starts in middle school and then it goes, I have to do well so that I do well in high school so that I can get into a top college. And in some cases, and not all schools, kids have to choose their classes that when they're incoming freshmen for the duration of high school. And what they say to me is, I didn't know what I wanted to do or what I was interested in at that point, and I really don't know all the range of options that are out there. And we as adults know there are good reasons for sort of having a strategy, but young people can often see this as added pressure and stress. And so as parents, this is really tricky because we have to have expectations of our kids, right? I mean, it's in the job description. So when kids don't have any expectations that they could achieve things in life, it is very difficult for them to have good outcomes. So we have to press our children. We have to expect that they do their best. But a lot of times kids can interpret that as their parents just adding to the existing academic stress they feel. And so it is very tricky. So this is where dialogue is very important, to be honest with your kids about why you're pushing them, and also to help you understand maybe where your kids feel like they need a nudge and where they feel like it's just added pressure. The young woman that you see on this slide is named Claire. She is a youth advocate, and she actually testified recently at a Senate Health, Education, Labor, and Pensions Committee hearing. And she said a couple things. So if you have the time, there is a recording of it. So if you have the time, I highly recommend that you listen to it. She made a couple of really good points. One is about academic achievement and having the adults around young people sort of separate academic achievement from kids' value as human beings or parental love, right? This is kind of what she talked about. She also talked about all of these other factors that you see affecting mental health on this slide. And she said when she was going through a really terrible time with anxiety and depression, that she sort of felt like, I don't know why this is happening, because I have great friends, I've got a nice family, I live in a safe neighborhood, and I go to a good school where people are nice, and I don't have the right to feel depressed or anxious. And it took a crisis for her to begin to accept that we all have mental health, right? And that she could feel more like this is normal, I can get through this. And she became a youth advocate, and she now speaks out about youth mental health. And she's a very articulate one at that. Next thing, please. So how do we know as parents when our kids might be going into a crisis, right? Or having difficulty? And there are a lot of these listed on the slide, but basically any change to your child's habits, interests, or ability to interact with friends or go to school should be taken seriously and should kind of get your spidey sense up a little bit. I do want to key in on the bottom middle box on suicide. As parents, we might be really hesitant to talk about suicide with our kids, and partly because it's unthinkable that our child might take their own life, right? Like a mental block comes down in our head. We just don't want to think about it. It's also an incredibly tricky conversation to have with your teenager, right? With a young person. You know, as a parent, it's like, if I manage it well, it could go well. And if I manage it badly, then what will happen? We also worry that we might put that idea in their head in some way. But the fact is that it's out there. They know about it. They know it exists. They may even have known someone in their community who made an attempt on their own life. They may themselves be having some suicidal thoughts. So as parents, we have conversations on difficult topics with our kids. We talk about drugs, we talk about sex, we talk about the dangers of driving and being careful drivers. We talk about death. So it is important for us to be able to have this courageous conversation about suicide with our young people. Doing so for a couple of reasons. One is it gives you the opportunity as the trusted adult in their lives to frame this topic in the way that you think it should be framed, right? It also gives you a chance to dispel misinformation that they may have gotten from social media or their friends and peers. And it also gives you that chance to say, you know what, no matter how tough a spot you're in, I'm here for you. We are here for you and we will support you. So let's keep talking, right? Though it is a difficult conversation to have, there are some really great resources out there to help facilitate that conversation in very age appropriate ways. So the Society for the Prevention of Suicide is one. The Jordan Porco Foundation, which is located in Connecticut. Also, they have some great resources. They are a partner of ours. And you can also look to government resources like the CDC, the Centers for Disease Control and Prevention, and SAMHSA, the Substance Abuse and Mental Health Agency as well. Next slide. Another way of thinking about whether a behavior is normal or if it's something you should be concerned about has to do with intensity, frequency, and duration. So you have a 3-year-old, they're going to have tantrums. Are they kind of tantrums where they're just kicking and screaming, or are they hitting themselves in the head? Are they banging their head against a wall? Are they hurting themselves in that process? How frequently are you observing this behavior or mood in your child, right? So maybe your teenager, you have to drag them out of bed and go to school. Maybe it's only when they have a test in a certain subject, or, it's not that frequent. But what if it kind of expands, right? What if it's like a week goes by and they're refusing to go to school? That is the duration piece. Above all, how is your child functioning in the sphere that they operate, right? School, home, activities, and friends. So what can we do as parents, educators, and community organizations to really encourage our kids to be aware of their emotions and to feel comfortable and accepting of their emotions and feelings? Next slide. So for little kids, a child's early years are the time to start building the awareness and that self-awareness of their feelings and the vocabulary to talk about their feelings. It's also a time for you to begin to model certain behaviors yourself. So you can use social emotional tools. There's great ones online that you can use. We happen to like these kimochis that you see on here. They're little feelings pillows. And we like them because they're tactile and they're really cute and they're like stuffies. And so people can use them. So if you're somebody who gets on the floor with their kid, you can, playing with blocks, the tower falls over, you can pull one of those out of the bag and say, oh, I'm disappointed. How do you feel? So kids can hug them, they could throw them, they can step on them. But even if you don't have those tools, there are ways to approach your kid when you're relaxed, when they're relaxed, when you're doing something together that you like. So if you're watching a show, you can, and say a cartoon character falls down and hits their head, you can say, oh, they're crying, they seem sad. Do you feel that way? So there are ways to bring social and emotional awareness into your everyday life with your young child. Like all of us, don't approach them when they're busy or tired, and don't try to engage when you're busy or tired or trying to get your kids out the door to school or make dinner. Believe it or not, I want to talk about a little bit about later elementary school too, because believe it or not, kids can be curious about puberty as early as like first, second, third grade, especially if they have older siblings. So in later elementary school, it may be appropriate to talk with your child about the normal physical changes and also emotional and mental health changes that will happen as they get older. I think we as parents are doing better than previous generations in talking about those physical changes, but it's really important for them to understand that other things are going to change as well as they get older and their brain matures. So check in and see how they're doing, and just let them make sure that they understand that if they have any worries or questions, they can come to you. Next slide, please. So with middle schoolers, it's a little trickier because middle schoolers are a little trickier. So maybe you notice that they are a little bit quieter than normal or a little moodier than normal. You can gently ask your child and just sort of say, I've noticed that you're a little quieter than normal. Would you like to talk about it? It also helps to be open about your own feelings and model that behavior. So maybe you're stressed, right? Show them how you deal with stress and how you take care of yourself. And that can be an example for them about how you deal with the natural ups and downs of your mental wellness. Also, we've talked about online media. Reassure them, I should say middle schoolers are going to make mistakes, right? Out in the real world and in the virtual world. And that can happen. They can get in over their head, and then they can come to you, right? So if they're in trouble, reassure them that you're going to help them with it, and talk with them then about what they have learned and how they might approach social media differently from having had that learning opportunity. Also with adolescents, the world feels really unpredictable and kind of out of control, both internally, physically, with a lot of the changes that are going on, but also given the stage that they are in brain development, they're starting to ask questions that don't have direct answers. So it's no longer like, what color is this, mom? It's blue. There are a lot of things that we as parents don't know, or a lot of problems in the world that they're going to be getting exposed to and sensitized to that really don't have easy or satisfying answers. And so for those reasons, it can feel really out of control. And their behavior may be a reflection of them struggling for that control. Tell them you understand that, and that you have a lot of empathy for that. And sometimes you feel that way too. Next slide. High school students and young adulthood, our job as parents, right, is to make them able to be independent, capable adults. And it's a part of our job, right, is not just to make sure that they're capable of financially supporting themselves and being successful in school and work. It's also making sure that they have the emotional resilience and they've developed strategies to be able to handle the inevitable curveballs that are going to come their way as young adults. So don't minimize or dismiss their feelings. It's really hard for young people to open up. And it's best not to compare, to say things like, well, other kids don't have that problem with X, or Katie doesn't seem to be, struggling with, hockey practice. Listen attentively without letting your judgment guide the conversation. And that is easier said than done. I have an 18-year-old. I fall into that myself. Respect and encourage your child's opinion. Acknowledge what they're going through. Assure them that you understand their thoughts and feelings. Encourage them to be open, and remind them that you were young once too, and you had those concerns. You had those same feelings. And then strategize with them. After the empathy and the listening, ask them if they've had thoughts about what might need to change. What do you think should be different? If they don't have ideas, they may have some ideas that they'd like to share. If they're coming to you because they've tried things and they really have no idea what to do, offer some suggestions and listen and have that back and forth with them so they develop the muscles to get to have the strategies that they can employ as adults. So I want to turn now to our other mental health crisis. Next slide, please. So the graphic that you see on here, the map, is from the American Psychological Association. It's 10 years old, but I think that this actually has probably gotten more acute through the pandemic. You can see the shortage areas for licensed psychologists are generally in the South, in some states in the Midwest, and in the West. What this doesn't show is county level or community level distribution. So we work with rural communities in Idaho and the Upper Peninsula of Michigan. So in those communities, there's a real shortage. There's one community that we work with that has one licensed psychologist for the entire community. That includes kids and adults. So accessing care is difficult. Inpatient psychiatric beds are in short supply. Also what we call step down programs or partial hospitalization programs, which exist as a sort of a step from inpatient back to integration in normal life. So in PHP programs, people can, kids can stay with their parents overnight and then go to a day program with intensive therapy. And studies have shown that the availability of partial hospitalization programs decreases the propensity to have another episode and end up back in the hospital with a psychiatric episode. These are very difficult to find. We also know that there are disparities in access to physical health services, as well as mental health services, especially for people of color and non-native English speakers. Finding a psychologist who takes insurance is also exceedingly difficult. 60% of psychologists only take private pay. Next slide, please. Not all kids are going to need medication, but for those who do, finding a child psychiatrist is incredibly difficult. 70% of US counties have no child psychiatrists. Psychiatry is a medical specialty. Child psychiatry is a subspecialty. And there are many reasons why the shortage exists. And I could give a whole talk on that subject. But in generally speaking, we have a mental health crisis and shortage in our country, particularly for kids, because until very recently, the idea that mental health is just as important as physical health has not been widely accepted. And you add to the fact that the prevailing attitude is often, you're a kid, what do you have to worry about? What do you have to be anxious about, right? You just have to go to school and hang out. I'm the one who has to pay the bills. But as we've seen, kids have a whole lot of stressors that they have to deal with in their daily lives. So in general, our society, and we've seen this globally now, has not placed much importance on mental health. And when something isn't important, it's not prioritized. It doesn't receive public and private funding, and it doesn't get the resources that it needs. And so because it's not in the public conversation, and then we can't address it. So I think of cancer at certain times. When I was growing up in the 1970s, cancer was the big C. People didn't talk about it, right? They didn't want to kind of talk about it because they didn't want to whistle past the graveyard, or if somebody that they knew had cancer, it was a private family matter. And what happened over time is that cancer survivors began to speak. They began to speak out about their experiences with chemotherapy, what it did to their bodies, what it did to their minds, what their families went through. And what we started to see is that society, once it started to talk about it, there was acceptance and support for people with cancer. There was also a huge government investment and private sector investment in early detection, prevention, and treatment. And so at this point, right, that investment led to a lot, all women get mammograms, right? We all get colonoscopies when we're in our 50s. So we catch cancer earlier. So we are able to prevent really bad outcomes. And the treatments have evolved as well so that cancer is no longer an automatic death sentence. We can apply this playbook to youth mental health. Next slide, please. So this is why I'm optimistic. The pandemic has been devastating. The loss of life, the change, the impact in all of our lives and our mental health, the impact on families and communities from a financial perspective. But it has made the acknowledgement of mental health challenges undeniable and brought them into the light. Also, when I talk to young people, they are much more self-aware about their mental health and they are much more willing to talk about it. We have a tremendous amount of work to do on this, especially among disadvantaged communities, but we are seeing some glimmers of hope among our young people. There are also now regular segments on national and local news and in the newspaper about youth mental health. And governments at all levels are starting to focus on this, right? We talked about the federal government. We are here because community organizations in Trumbull are getting together to talk about this, and then you can get funding, right? And all of this is happening because we have finally realized and accepted as a society that youth mental health is a collective problem and it requires collective effort. So all of this to say that we will do better for our kids and grandkids. We must. There is no alternative. And the gears of change are starting to turn in a positive way. Thank you so much for having me here this evening. I really appreciate it. And I'm happy to take some of your questions.
So if anybody has any questions, you're welcome to pop them into the Q&A. Right now we haven't gotten any because Valerie was so thorough and comprehensive. Okay, first question we've got. Are there guidelines for the number and types of mental health personnel schools should have based on numbers of students? If so, can we learn about these? Also, my understanding is that it's almost impossible to find help for kids here in Fairfield County since depression escalated so much during the pandemic. Any suggestions? So 2 big questions there.
Yeah, I think so. That one, that is a great question, and I don't know the answer to that. I will say that for the school for the community in Idaho, they have one for about 10,000 people. So for 10,000 students in that community. So across that geographic region. So, so we know it's severe, and I can definitely find that out and get back to you about that. I think in terms of getting resources, a lot has to change in how we train and how we incentivize mental health professionals. So we have under-resourced that relative to other priorities in our society, and which is very difficult. And it's going to take a long time for us to turn this around. There needs to be increased funding for mental health education for people to become psychiatrists and psychologists. Because right now, with the expense of going to medical school, a lot of people choose specialties that are higher paying than like primary care or mental health. So we need to turn that around, and that requires legislation, and it requires a lot more in public investment. In the short term, I think, I don't have great advice on that because the number is limited. But we have found that people who are persistent and call multiple times, right? And you never know when somebody's going to have an opening. So being persistent, and if you've left messages, leave more messages, because sometimes that you can squeak in an opening if you're assertive about that.
Thank you. I've got a question here. Are there any plans to help expand psychiatric hospital beds for children in Connecticut? From a personal experience, we had a 3-day stay in the ER before a bed opened up.
Yeah, I'm not aware of that. I don't know the exact situation in terms of resources in Connecticut itself. Maybe others on the call can speak to that.
I don't know that we're set up so that participants can speak to the question, but I don't know if anyone wants to can they put their hand up, Bill, if they So if anyone wants to speak to that or has knowledge to speak to that and wants to put their hands up, Bill will be able to see you.
Yeah, I mean, one thing, excuse me, one thing that has happened in Maryland is that there have been emergency funds for mental health, which has expanded hospitals and partial hospitalization. I don't know if Connecticut or your specific county has had any sort of emergency resources available for expansion of those services. But I know in Maryland, we have had an uptick to try to balance. There's still a shortage here, but I know that there has been some resource flowing through the system.
So it might be worthwhile reaching out to our legislators, our state legislators, to talk about whether there's any plans for that kind of funding. We have another question about guidelines for screen time for elementary school kids and whether screen time should also include TV time.
Yeah, so there are guidelines that are out there. I think they're ones that are specific. I'm blanking on the name of the organization that has a lot of resources out there about those guidelines. I think, it's the American Academy of Pediatrics. They have guidelines, and the American Psychiatry Association as well. They have guidelines out there, and they've thought a lot about it. I will say that they typically will include TV time in screen time as well.
Got a comment here. Thank you for this presentation. As a college professor, I would like to know if faculty members or teachers as non-healthcare professionals should try to be a resource to intervene and help students who seem to be struggling with issues of mental health, or if we should send students directly to counselors who may better understand how to address their needs. And what should we be doing to better support students even without having that background? So great question.
Yeah, so it's a three-part question. So I think as educators, people who work with kids, so part of what we want to do at the Youth Mental Health Project is expand our programming to provide resources to people who maybe aren't parents, but who are really important and interact with kids and who see kids in different settings than maybe what parents and families do. So they sometimes pick up on things. And so getting educated about that is really important. I think there are rules about, and it differs by state, about mandatory reporting. And I don't know if particular schools adhere to mandatory reporting about situations where kids are in crisis. That is something to consider. I think, I think it really depends on the situation, and there's some judgment in there as well. I think it's always appreciated from kids if an adult reaches out to them and talks to them and engages and says, I'm understanding and seeing that there's something wrong. I don't see that there's a downside to that. And then if it needs to be, then it's passed off to a counselor or a school guidance counselor to help manage. But I think that first, but the guidance counselor kind of can't be everywhere either, right? They don't see everything that educators see, particularly in college settings. So I think it is important to, if you want to reach out, don't hesitate to do it, because it will always be appreciated. And at the very least, they know that you care and you've made that connection with them, so that if they do change their mind and want to talk, that you're there for them. And I don't see that there's a downside for that or a risk.
I have a comment and a question. I appreciate you saying that youth mental health is a collective effort. How can we have our community see the crisis and get a collective effort? It seems as though there's a bit of denial in parts of the community that it is a crisis. How do we advocate and take action?
Yeah, I think that's true. And there, and I think this is true of not just your community, but all across the country, right? This is starting to grow, but there's a lot of well, this doesn't happen in my community. So I think awareness raising events, I think in schools, certainly we come and we talk to schools, PTAs, and engage parents and sort of raise awareness about it and understand that it happens everywhere. I also think that there can be community events. So when you have community events, have, people talking about mental health, have a table, be out there and begin to kind of normalize those conversations within the community. And also, if there are pockets of resistance, engaging and not judging, but helping to understand what that resistance is and what are the factors that are holding people back, asking a lot of questions and really trying to get that information. And also, I think what is also helpful is that if you can get kind of influencers in the community, people who are respected, and find those subgroups where those people, circulate. Maybe it's somebody on the local PTA, right? Or another sort of trusted parent. And that's not always somebody who has a leadership role, but it's just somebody that other people take their cues from. Those are all options for trying to break that down. And it's going to take time, and some people are going to be in denial about it. The question is how to get those people who are open to it and hearing about it and make the change from there. I think going into the pockets of most resistance is a difficult place to start.
Kind of following up on that, one of our participants was wondering, in your experience, have you seen the most successful initiatives coming from town, the schools, or coalition initiatives like TPOD, like ours? Is there a recipe for success that you've seen?
So I would say in the communities that we work, it's that communication among the community organizations. So we've noticed, just for us, we get much stronger uptake of our parents and attendance in our parent support groups when we have local community partners working together. That for us is very powerful. And we've seen, a lot more people come in when we're all sort of talking about the issue and letting people know that these resources exist and where they can go for help. So I think if you can manage it, right, if you can pull it off in your community, a community-wide effort, with special events and figuring out, maybe you have, town events that are fun, like a carnival or something, that you have representation there. But it takes sort of consistency and persistence. I will say that there is a school in Connecticut that reached out to us, and it was high school students who started their own mental health club at their school. And they did a fundraiser for us. They set up a table at their fall festival. There were a couple of girls there, and they had a lot of students come by, and then they started this club, and they've had a few dozen kids join it. So engaging young people as well in the conversation is really important, right? Because you want to make sure that you're talking about it, not just to parents, but engaging kids about what they want their parents to know, right? So the kids are a really important constituency in all of this, trying to change a community.
Great point. We've got a question here about your thoughts on training for mental health first aid for classroom teachers, parents, community members.
Yes.
Do it.
Yes, do it. Absolutely do it. Yeah.
Here's a comment that someone who thinks a survey would help us to know more about what our students really need. I think we need to hear from them firsthand to know how to plan next steps. Little bit of a preview. TPOD has just surveyed all of our 7th to 12th graders in the Trumbull Public Schools, and we will be presenting our first results, which include some mental health data, at the March 8th Board of Ed meeting. So that will be the first glimpse of kind of what we've learned about what our students reported about their depression, mostly during the last year.
That's really great. I mean, that's ahead of so many other communities out there. They haven't even gotten as far as you all have gotten.
One of our PTA council members would love information about how to connect the PTAs to youth mental health projects, so we can facilitate that. But if you have, I think your contact information, we have your contact information that we can get out.
And we love talking to PTAs. We really do. They are kind of in the schools, and they do so much for the schools. And so we always really enjoy talking with PTAs.
And then another question, are there any specific curricula or training for faculty and staff you would recommend or that you know are used successfully elsewhere?
Not that I'm aware of. I mean, these, I actually talked to someone in Israel who reached out to us with a very similar question. And they had looked, at US resources, and there wasn't anything specific that really met a community's needs that they found, which is not to say that they don't exist, but he wasn't able to find it. We haven't been able to find it. So if there is one, we're just not aware.
Okay. So what are schools doing that are they cobbling together options or?
The ones that we've spoken with, yeah, sometimes they use things, but, and I can't remember what the names of them were, but they were not, whatever they were using was not, they did not think it was effective. And it wasn't really what they were looking for. And so they've sort of been cobbling together their own kind of curricula. There is one that the Kimochis people, and I haven't actually used it, but they have a curriculum that goes with their Kimochis, their feelings pillows for younger kids. And I think they're starting to take it to middle schoolers now. But I don't know any of the school districts that was tested in. But it may be worth looking at.
Wonderful. We have a couple of comments just about, kind of reinforcing your point about persistence, that they need, that persistence mattered when they were dealing with a family member who needed to be hospitalized in Massachusetts, and the number of calls and eventually getting an admission into a hospital. So just reiterating the point you made about.
It shouldn't be that way. I mean, it shouldn't be that way. Like, it shouldn't take that much that much persistence. But that's where we are right now. But it is deeply regrettable.
Can you explain the relationship between anxiety and depression and genetics? Can you share your thoughts about building resilience in young people? Are we not doing enough?
Yeah, so from what I have read and understand, and from talking to people, mental health challenges sort of go hand in hand. They kind of can coexist. And that is because neurologically, they issue from the same sort of part of the brain. There's a lot of brain science that's being done now. There's a lot that we don't know, but we do know that these things co-occur together. And even with kids who have autism, they can also have ADHD and anxiety as well. So these things are co-occurring, which makes it so difficult. Like with our son's case, it took a while. There were multiple diagnoses, and it just took a while to disentangle them because they are so co-occurring.
How about building resilience?
Yeah, I mean, I think giving the vocabulary helps them kind of feel, and validating their feeling, and then doing that strategizing really helps to build that resilience, right? And I think as parents, we build our kids up when they fall. And it's when they get into middle school, high school, where they want to pick themselves back up again. And so really modeling certain behaviors, admitting that, you have struggled, you've made mistakes, maybe you made some mistakes when you were a teenager or in your 20s, and really helping them identify, giving them the vocabulary and the self-awareness, and then giving them the tools that they need, and really being able to think through, okay, what do I do in this situation? I've had this situation before, and this is what I did, and that didn't work. So what do I do now? And beginning to help them not agonize, but to do that strategizing. So not really no magic solution on that, I don't think.
No, I think that's great. That was all the questions we have gotten up, the great questions and great points. I've added into the chat our TPOD resource guide, which has live links to a number of our partners locally and statewide and nationally for a number of behavioral health issues. I've also added the flyer for our next Let's Talk Mental Health Trumbull session in March. I want to thank Valerie for this wonderful presentation. Bill, are you able to enable Donna DeLuca to speak? Because I know she'd like to talk about her organization.
Sure, I'll bring her in as panelist.
Wonderful, thank you. Don, are you there? Just muted.
I am. Hi, everybody.
Hi, Donna.
It's so good to see you, Valerie. That was amazing. So needed. I just wanted to talk for a moment about Confidant Health and the support that we offer families and individuals who are struggling with mental health and substance use disorders, more on the adolescent to through adulthood stage of life, and critical pre-addiction services are offered through Confidant Health. What the work that Trumbull does is absolutely astounding, and it really is a model for so many other parts of the state and for the country. If we can embrace all of these concepts and just continue the conversation, we are just going to reach so many more in prevention and intervention for mental health and substance use disorders. So thank you. And I just feel so privileged to be part of what TPOD and the town of Trumbull are doing in collaboration with your wonderful organization. I know you're in Brookfield and kind of spreading, and it's great stuff. We just need to keep talking, and I'm very anxious for the March 16th get together.
We had one more question sneak through, so I'm gonna, if you don't mind. How do we get the schools, faculty and administration, to put the discussions into action in supporting students that struggle with mental health issues?
Yeah, I mean, I think part of it is, if there is a PTA, that can be really helpful in having them work with the administration. I think engaging as parents, I think parents as a group can collectively raise that up with the schools as well. And I also think the students can be a big part of this as well. So I do think there's different ways that you can come together to kind of put pressure, for lack of a better word, on the schools to begin to prioritize this. Certainly some schools have, and some schools have done a pretty good job of it. But in other schools, and also keep in mind that schools too have been under a lot of pressure over the past couple of years and might be stretched thin. So understanding what a realistic timeline is for them and what is realistic for them to take on is going to be really helpful too, so that they're seeing this as something that can help themselves as well in terms of the actual educational, the focused educational process that they have. So I think that those three groups are really instrumental in getting schools to kind of expand their vision of what social emotional learning is and what those supports need to be in schools.
Thank you. Thank you, everyone. This was wonderful kickoff to our first Let's Talk Mental Health Trumbull. I want to thank, on behalf of TPOD, I want to thank our first selectman, Vicki Tesoro, for her unwavering support of the work that we're doing on this topic. We are incredibly fortunate. I also want to thank Confidant Health and the Trumbull PTA Council, my friend Abby, Trumbull EMS, and the Mary J. Sherlock Counseling Center, as well as some other parent volunteers who really have put a lot of time into thinking about how we can formulate a program that would be meaningful and impactful to our families. So I want to thank all of them. We will be sending out an evaluation of the session. So I hope you'll all take a few minutes just to kind of tell us what you thought and what we could add and improve, so that we can continue to expand this session in future months. So as I said, the flyer for next month is in the chat. I hope we'll see you then so we can talk about the pressure to be perfect with Dr. Alicia Farrell, who's a wonderful partner of ours. Vicki, do you have any final thoughts? Or
I just want to say thank you to Valerie again. That was an amazing discussion, and to all of our attendees for, listening and participating in the questions and answers were great. Obviously, this is an issue that continues to seek support from all sectors. I certainly, as Melissa said, continue to be actively involved in the pursuit to make things better for all of our community members. So certainly my door is always open for people to reach out to me as well. I started many years ago in this area of prevention and continue to fight for assistance and support for especially our youth, and certainly for all of our residents in town. So thank you again. That was wonderful.
Thank you.
Good night.
Good night. Enjoy the rest of your evening.
Good night.